Good afternoon, everyone. I'm
Good
Jennifer
morning.
Harris, so I will go ahead and get started and introduce myself. I am the health policy advocate at Alabama Rise, which is a statewide membership organization, and we work with many partners, including the EWE Foundation, to advocate policies for a better Alabama for all. And I also am a caregiver of someone with a chronic illness. My youngest child, my daughter, has sickle cell disease. So I'm happy and glad to be here with you all today.
And I'm Jennifer Griffin. I'm going to be moderating. I'm the Director of Family Support at the LGS Foundation. LGS is Lennox-Gastaut syndrome, and I am also the parent and caregiver of my son, Theo, who is 21 and has LGS. And Rene, I believe, were you supposed to be speaking first? Yeah. Okay. Yeah. So why don't you get started, and then afterwards, Allison, when it's your turn, you can introduce yourself and then just go right into your presentation.
Okay. I'm Rene Sprague. I am currently working as a nurse practitioner for supportive and palliative care at a children's hospital in Alabama. Most importantly, I'm a mom to 3 kiddos, and my oldest son, also named Elijah, we adopted him at 6 months old. He was born 18 weeks prematurely. So because of that premature birth, we had a host of medical complexity and issues. The main one being brain injury, hydrocephalus. So we have multiple diagnoses, including cerebral palsy, autism, short gut, seizure disorder. He was our first kid, only kid for 4 years. And I was initially a respiratory therapist and went back to school and was finishing my master's in nursing education when we got him. And with 3 medical degrees, I still didn't know how to take care of him. And there was nobody coming to my house to tell me how to take care of him or what resources were available. What I was getting was a lot of doctors telling me his limitations and that he wasn't going to live past a certain age and not to pursue certain therapies because they weren't going to work. And I mean, this was 18 years ago, but I decided differently. And I'm a very type A driven personality, which is good and bad. But for him, it was good because I was determined that I was going to at least seek out resources that was going to improve the quality of his life, even if the quantity was different than what I had anticipated. So that kind of led me on a journey to, number one, realizing how little our special needs population is supported in the state of Alabama. It showed me the lack of resources that we had, and it definitely showed me a need for policy change and to become more politically active, which wasn't hard because I was barely voting at that point in my life. So when Sarita asked me to kind of talk about this kind of combination of advocacy and special needs parenting, or just parenting in general, I started thinking of pros and cons of having special needs parents as primary advocates for policy change. Special needs parents, especially seasoned special needs parents, they've spent their kids' whole life advocating. And it may not have been for policy change, but it was for change. And so they're naturally gifted with this skill set, and it's a skill set they either, most of the time, they had to learn. It wasn't something that they were prepared to do or even sought out. I mean, I adopted a child and still wasn't seeking out special needs advocacy. There's a lot of pros to seasoned special needs parents advocating. For me, the primary one is their persistence and their investing, the level of investing that they would have working toward the policy change or working toward any change at all that would benefit their child. These families are driven without question. They obviously have a lot of firsthand experience, that kind of boots on the ground experience that you're not going to get if you aren't living the life. And they usually will come to you with a wealth of information and resources because they've had to seek them out, again, because they had no other choice for their child. And they usually know how to collaborate fairly well. Now, this can go, in my experience, one of 2 ways. The primary bulk of my clientele here at the hospital are special needs or rare disease diagnoses. And we also, offer a lot of supportive care, not just palliative. And in that supportive care, part of my job and my assessment of that family is finding out what they know about their child, what they know about their disease processes, and then what resources they have available to them. And I have moms and dads that can give you a list of resources that they know about and people that they're working with, foundations that they've started, all these things. And then I have the parents that know about their child and are pissed. They are not looking to collaborate. And usually it's because they've been shut down multiple other times. Those are my favorite families, by the way. And getting to kind of work with them and teach them, honestly, how to collaborate in a way that is assertive, but is also proactive. And then, you know, with any special needs parenting or any living with a rare disease, there's a grief that just goes with it. And it's different for each person. How they handle it is different for each family, each patient. But what I've learned in my journey is that I needed a purpose for that grief. I needed a purpose for what I was experiencing and what my child was having to experience and struggle through. For me, it was starting this program and getting to reach a lot of other families. But for everybody, and for Sarita, it was starting this foundation. But for each family, it's different. And so advocacy helps give them a voice. And it helps define their purpose for them, if that is a fit for them. Most of our special needs parents or rare disease parents are marginalized populations. These aren't people, for the most part, that come to you well educated with 2-income families that are, you know, heavily insured. These are families that are poor. A lot of African American families that aren't afforded an education like some of their counterparts, and so they're already marginalized, and then they're handed a diagnosis or birth a child with a diagnosis, and it's overwhelming. And so some of those families have become my biggest advocates for policy change. Honestly, they have educated themselves on who they need to reach out to change the laws in Alabama for stuff like y'all were just talking about, transitioning to adult. For once kids turn 21, even on Medicaid, a lot of services are no longer provided. Physical therapy, OT, speech, ABA therapy. I guess they just assume everybody's cured and nobody has a disorder or disease anymore, or any deficits, but it goes away. And so you are in this cocoon of pediatric world where you are given all the things like we just talked about. And then at 21, it abruptly ends. So I've got several parents that are working now on changing the policies and making Medicaid equitable to Blue Cross Blue Shield so that their kids still get the services that they deserve once they turn 21. Also, when I am able to, not just me, but when you can direct a family toward the appropriate avenue of advocacy for their family, it prevents isolation. It's a very isolating place to raise a child or to have a rare disease. And this finds your people for you. I never would have known Sarita had I not had Elijah, and she not had her Elijah, and us met through that. Like, and I have a lot of stories like that just for me specifically of people I never would have known if I had not adopted my child, but also pursued advocacy for him to improve his life. The cons, and there's not many, but there are some, of special needs parents. If you're looking only at special needs families and rare disease families to advocate for themselves, you don't have time. I'm tired. I have a child. I got 3 kids. One of them's medically fragile. I have a full-time job that's more than full-time, and I'm married. And 80% of families with rare disease and special needs end in divorce. Like, that's huge. That's huge for the family structure. It's huge for the children, and it's huge for the parents that then become single parents. In some families, you're going to find that they are more emotional than objective. That's impossible to avoid because you're talking about something you're very passionate about. So it's finding that fine line between objectivity with some information and emotion versus just straight emotion, because you will get shut down in policy change meetings if you become emotional without facts to back it up. They also, a lot of our special needs families, in my experience, very few are Sarita. Very few have this broad scope. A lot have the very narrow scope, and they're very interested in their child's disease without recognizing that, yes, we can focus on Like I can focus on my Elijah's illnesses, but I also, by doing that, I can then help, everyone that has a special needs or a rare disease. That's where your seasoned special needs parents come in, because they know it, they get it, and they're ready. Also, like I said, retired. Special needs families are exhausted. And their kids get sick, so you can depend on them and you can ask them to do the things, but then when they have a kid that's chronically hospitalized like mine, I can promise you all the things, but if my kid is sick, I'm not coming. You're not going to see me, and I will make no apologies for that. And it's the same for the majority of families that you'll deal with. And they, they're part of the exhaustion is they've already had to fight for everything probably their kids been given. Some have to fight just for Medicaid, for insurance, fight for education, fight for doctors, fight for healthcare, fight to keep their jobs. I mean, fight for inclusion. It's a constant fight. So when you add, they want to add this to their plate, or you ask them to add advocacy to their plate, it can be overwhelming. So I would say reliability probably can be an issue. However, you will not find a more dedicated group of advocates than parents or caregivers that have had to fight for everything their kids have ever gotten. I love my job, but I get taught more in my job than I teach, for sure. And that honestly is part of the reason I still do what I do, because I'm still learning things and about my kid and things that can help him transition to adulthood, because now we're 18. And ways not only to help him, but also to help me, to help my husband, to help my other two children, how we react and how we cope with the life that we have, how we will cope with his loss if and when that happens. Most parents don't have to think about losing their children. Other parents know it's a fact. And that's something that never gets easy, and it's something that never goes away. And so that's where a lot of my parents and parents that I've met, I say my parents like they're only mine, but just parents that I've met throughout the 18 years, that's what keeps them going, honestly. Even if and when they lose their child, is that's their purpose, and that's they're their kid's voice. I mean, my kid has words, but not words that most people understand. And so I am his voice, and I know that. And so when I am tired, I'm still going to advocate. Am I a great policy changer? Probably not. But will I continue to try? Absolutely. And will I continue to support other families that are trying? Yes. And so I think kind of building your army of whatever policy it is that we're going for Main Street, it was newborn screening, but there's plenty of other changes that need to happen for our kids and adults. I call them all kids, but they're transitioning to adults, to support them. And I think the ultimate starting point is a caregiver that is ready to kind of take that banner and to join with other people to make the changes that we need for these kiddos.
Yes, and I'm just waiting. There we go. We've got screen sharing. Thank you, Sarita and Renee. Thank you for your presentation. It's an honor for me to be here and be part of this panel today. And as you can see in that photo, that is my forever 4-year-old son, Travis. And tackling tragedy is what brought me into the role of advocacy specifically for rare diseases. Next slide, please. And I'd like to give a huge thank you to the EWE Foundation, to beautiful Elijah Edwards and the whole Edwards family. Even though we're a country apart, I do consider them part of our family now, and I'm so lucky to be able to advocate along with them. Next slide, please. I'd like to tell you a little bit more about Travis. What we knew about Travis in his 4 short years on this earth was he was a character with a big, huge personality that was eclipsed only by his megawatt smile. As you can see there, there's some photos of him with some of his favorite people. He attracted people everywhere he went. people just flocked to him, and he always wanted to tell a joke or share a story to entertain people, and he loved to help around the house. As you can see in that picture on the bottom right, he's helping to sweep the pool, and that was quite an ambition for such a little guy. And so those are some of the things that we knew about Travis, just this incredible love for life. What we didn't know about Travis, next slide, please. Travis was born missing his spleen. The spleen is such a vital part of a young child's still developing immune system, and Travis didn't have it. This rare disease is called isolated congenital asplenia. It limited Travis's immune system and left him powerless to fight certain bacterial infections. In Travis's case, it was a matter of hours when he developed sepsis, first exhibited a high fever, until he passed away. We're talking a matter of 20 hours, all because he was living with a silent killer of an unknown, undiagnosed, and untreated rare disease. Next slide, please. Some facts I'll share with you about ICA before we talk more about how I got involved in advocacy. The spleen is absent or non-functioning. It's considered to be both a primary immunodeficiency and a genetic birth defect. And in fact, it's the only known birth defect involving a lymphoid organ with no additional developmental abnormalities. It leaves patients at high risk of fulminant bacterial infections, and the prevalence of this rare disease is approximately 1 in 300,000 babies. I share this with you, and I have one more thing I'd like to share with you. Next slide, please. So Travis, for me, Travis's death in August of 2018 was the latest in a long line of tragedies striking our family. In 2012, our premature twins were born at just 24 weeks gestation. Our daughter Shelby lived for 8 days, and our son Dalton lived for just 4 days. In 2015, we lost both our Great Dane, Ike. I'm a big animal lover, and so our animals were like additional members of our family. We also lost my dad, Joe, to a 9-year battle with 2 different types of cancer. And then in 2018, in March, we lost my husband, Jamie, our other Great Dane lab mix, Abby, and finally, ultimately in August, Travis, to the rare disease isolated congenital asplenia. I share this with you not to make you sad or to feel sorry for me, but so that you have an understanding of why I do what I do. Like Rene said a few minutes ago, my role was wife and mother, a caregiver to my dad. What was I supposed to do now? What could be my purpose amidst all that grief, like she so beautifully put it? And so, next slide, please. What I had to do was figure out a way, and I love this quote because it captures my journey from Bishop Desmond Tutu, and that is, hope is being able to see the light in spite of the darkness. That is how Team for Travis was formed as a nonprofit organization, and that is how we came to be advocates for not just kids with asplenia. That's always first and foremost my personal priority, but also how we can advocate and make a change for as many patients as possible living with the 10,000 known rare diseases. How can we do something to help share their stories and get our voices together to make the most impact and drive change that impacts and benefits the community? Next slide, please. Along the way, I couldn't do it without an amazing group of friends, both old friends who knew Travis, knew my family, and newer friends that I've made over the last 5 years that have come alongside us, stepped up, and have done so much to make Team for Travis help be a voice and amplify the voice of the rare disease community. Next slide, please. We were extremely fortunate too to partner with the researchers studying the genetic deficiencies in the genetic mutations that cause asplenia. And we've been able to help support their research through the funding of a grant where we partnered with the organization Uplifting Athletes, and we're able to fund Maurizio Rissolino's work in the Solari Lab at University of California, San Francisco. Next slide, please. So along the way, and you can see in that picture, that's one of Travis's youngest friends, Benjamin. He has been an incredible ally to our cause. And even when he was just 5 years old at our very first event, he helped raise awareness. He took those flyers and our stickers and a pen, put together these little packets on his own, and walked around to everyone in the restaurant and interrupted their dinner and said, "Excuse me, please read this about my friend Travis." So it doesn't matter how old or how young you are, you can always make your voice make a difference. At Team for Travis, our ultimate goal is to change how ICA is diagnosed. And doing that, we focus on 3 key areas: awareness, advocacy, and funding research. What I'm here to focus on today is the advocacy piece. Next slide, please. We've accomplished awareness by getting then Governor Arizona Doug Ducey to issue proclamations in 2021 and 2022 to declare August 25th, Travis's anniversary date, as the Asplenia Awareness Day here in the state of Arizona. We've also been able to present and educate perinatologists and obstetric providers and the pharmacy community here in the Phoenix area and in the state of Arizona through giving talks and education and awareness. And then with the advocacy piece, next slide, please. One of the things that I'm most proud of is earlier this year, and you can see on the bottom right, that is me at the Arizona State Capitol with my state congressman, Steve Montenegro. He introduced a bill calling for access to rapid whole genome sequencing for critically ill children in Arizona's NICUs. And that bill, it's a small step, it's an early step to help bring quicker, faster, more comprehensive diagnostic tools to the hands of medical providers so that we can diagnose rare diseases for children, for those critically ill children, our most vulnerable population, quicker. And I had the privilege and honor of being able to partner with Representative Montenegro and testify to the Arizona House, Arizona Senate Health and Human Services Committees and Appropriations Committee. And we were able to have Governor Hobbs sign the bill into she incorporated it into the fiscal year 2024 budget. We received both state and federal funding, and this is a program that will start effective next year for our state's NICU units. So that is one of our accomplishments in the advocacy piece. We've also advocated at the federal level and some of the victories we've had there are our Congresswoman Debbie Lesko and Congressman Tom O'Halloran joined the Rare Disease Congressional Caucus at our request. And we've also helped serve and mentor other advocates, other rare disease patients and families as they've begun or advanced their personal advocacy journey. So those are some of the ways that we've contributed to helping raise patient voices within the rare community. Next slide, please. And finally, as I mentioned earlier, last year, we were able to raise enough funding to partner with Uplifting Athletes and give a $20,000 grant to Dr. Rissolino for his continued study of the genetic causes for asplenia in the mouse model. And we were also this year a project that we're working to continue funding the whole genome sequencing for ICA patients and families in the Casanova lab at Rockefeller University. Next slide, please. And along the way, some of the community partnerships that have been a tremendous help to us, and we've been fortunate enough to be involved in their events. And that's the Every Life Foundation for Rare Diseases, their sister organization, Rare Disease Legislative Advocates, the National Organization for Rare Disorders, Global Genes, and the National Institutes of Health. And here in Phoenix, we're extremely fortunate and happy for our partnership with the Pediatric Pharmacology program at Midwestern University. We've been able to speak for the last 2 years, and their student club, Pharm Peds, they do an incredible presentation for Rare Disease Week. They even bought a zebra costume, an inflatable zebra costume, and one of their students wears the zebra costume around campus, again, to call rare disease awareness and educate their fellow students about our rare community. Next slide, please. And as I mentioned earlier, young Benjamin, he has officially become an Asplenia ambassador. He was able even to give a presentation at his elementary school when he was chosen student of the week. And he shared with his teacher and his classmates all about his work as Team for Travis's Asplenia ambassador. We've got other patient families that have been impacted by asplenia across the US and throughout the world. As you can see, one of our families lives in Germany. We have another in Boston. And then, as I mentioned, equally important, you're never too young to be an ambassador for a rare disease. Benjamin started at age 5. You're also never too old. As you can see, the man in the lower right corner, he is my 93-year-old cousin, and he wore a Spread Travis Love t-shirt purposely on the day he received his COVID vaccine so that he could tell all of the nurses at the facility and educate them about asplenia and rare diseases. So again, enlist help from your community. As Rene said, building your army. I always say building your tribe, but it's the same slices, different slices of the same apple. And without that community support, we wouldn't be where we are. So next slide, please. And another unique way our organization has chosen to spread advocacy and awareness is by these little orange Spread Travis Love rocks. And they literally have gone around the world. We now have rocks in all 50 states, several Canadian provinces, and on every continent except Antarctica. So if you'd like to have a rock, I'll include my email in the comments and send me a message. And then finally, I'll close out with another one of my favorite quotes. Next slide, please. Here is our contact information. We'd love to have you follow us on social media. And like I said, I'll put my email address in the chat. And finally, I promise this is the last slide with the quote that I mentioned. Sarita. We are angels with only one wing. Only embracing each other are we able to fly. And that is by the Italian author Luciano di Crescenzo. And as I may have mentioned, or you may have guessed, I come from a long line of Italians. So thank you so much for your time today. And I turn it over so we can move on to the next panelist.
So now I can start my video. Good. Hi, everybody. Wow, both of those talks were so inspiring and also gave me, I think we'll have plenty to talk about. First of all, I love that the theme from both Rene and Allison was a theme of collaboration, right? Because we can't really do this alone. I mean, we can, but at the same time, it's always better to have partnerships. Actually, one of my favorite quotes, and I love quotes too, Allison, is the Dalai Lama's one about, if you think you're too small to make a difference, try sleeping with a mosquito. I think that is something that when we're inspiring people to become advocates and to raise their voices, we, obviously as caregivers of loved ones with special needs or special healthcare needs, that is, we are motivated by that. But why is it that all of us aren't advocates? Why is it that we all don't have that capability? And I'd love to hear from the panelists to talk about what is it in you, aside from the obvious. I mean, Allison, you were definitely inspired by a great deal of tragedy and trying to turn tragedy into something. But what is it, do you think, that gave you that? Is there something in your background, or what was it that made you one of those people that wanted to lead and make change?
Partly, Jennifer, for me, you saw I shared the photo of my dad. He endured a 9-year cancer battle, and everyone he met, they commented to me later, your dad had such a zest for life and such a joy. Even though he was sick, we never knew it. You'd never know it because he didn't want to mire down in the sympathy and in the darkness of a tragic disease. So I draw inspiration from him. And then honestly, simply, I didn't know what else to do. Like, how could I have this knowledge of a rare disease that is treatable with detection, but nothing is being done to detect it? So I just had to do it. And selfishly, it still allows me to be able to be Travis's mom and share him in the world where his legacy is making a difference for other children.
Love that. Jennifer or Rene, do you have anything to add to that about your own? What is it about you? I think you're on mute, Rene.
I needed to honestly have a direction. Once we adopted Elijah, I've always had a heart, I think, for marginalized populations. I grew up with my parents doing foster care, and so that kind of was just part of my makeup, I think. But when I realized my privilege at being able to have the resources and find the resource and even pay for them if needed for my kid, and I knew the populations that weren't afforded the same privilege, and that really bothered me. And so I started with advocacy just in my community, not necessarily with a diagnosis, but just in my community with special needs parents. But I soon realized how isolating parenting a special needs kid was, and lost myself a lot along the way, lost my marriage along the way, and we kind of had to find that again. And I knew to parent any other children, and especially to parent the child that I had to figure out who my people were. So that kind of spearheaded that. And then the deeper I got into that, the more I realized was lacking. So it's just kind of this foundation. You just keep building and finding the need and meeting that need, and then finding the next need, which naturally tended toward advocacy.
Well, I think you and I are living parallel lives. You spent everything you said. I so agree with that. I know that, you got to find your tribe. It's, Allison said finding your tribe. You said, I think, building your army. But I like both of those. What about you, Jennifer?
I always like to say that I was a natural born advocate. Just as a little kid, I always said I wanted to go to law school and work in policy and making changes and advocating for people. So that's kind of where I kind of got my start. But I also think it's that family, kind of like what the other panelists said. I kind of saw my mother was a public health social worker. My aunt was a mental health social worker, but just seeing that there was needs out there, that there are people that needed support. And I also see advocacy as a way to connect with other people, because sometimes when you're going through things, even though you're passionate about it and you care about it, it can be isolating, or it can feel lonely, or like you're the only person that's doing this or cares as much about it. And I just kind of see that connection in the advocacy work as well.
Yeah, that's amazing. I mean, I know that, I have Rene, I have 3 children as well, and my son is the one with special needs, and I have 2 daughters who are older. And I used to always say to my daughter, when she was younger, and she was just growing up, I'd say, you're really good at identifying a problem. You're really good at pointing at something and saying, that's a problem. I said, so what's the next step? The next step is, what are we going to do about this problem? And I know that for me, and I think for all of us, who have children with rare diseases, where there's not a lot of research and funding and all of that good stuff, you feel this sense of helplessness. And at least if I'm doing something, it makes me feel like I'm doing something for him. Because when my son LGS is, he has lots of seizures. And so our kids have like hundreds of seizures a day sometimes. And so you're sitting there watching your child have a seizure and you're thinking, there's nothing I can do. I can, unless I can give him a rescue med sometimes, but the rest of the time I just watch. So I don't like to just sit and watch. So, and I think we're all very similar, very like-minded that way. Rene, you used the word fight. And fight can have so many negative connotations, right, to it. And but you also used the word collaborate, which I think that how do we fight collaboratively? Like, is that something that's even possible? Can you speak to that? You're muted again.
Every time, every single time. That's because they're like building an office next to mine. So if I don't mute it some, you're going to hear like the jackhammer.
That's okay. We'll let you know.
Yeah, I think that, so Allison, my dad also had a 10-year battle with cancer and died not long ago. And I also took care of him. So and he was the same way, like never complained about it. But he, when they named me Rene means peaceful, which is the opposite of my personality. And my dad told me that he screwed me because he thought that I would be a peaceful child, and I came out fighting. Literally, that's my whole, if I get upset, I'm angry. I don't cry. Like I want to punch a wall. I don't want to like cry about it. I want to hit a wall, move on. And I think that prepared me to parent my Elijah, because I had to learn though to fight collaboratively and not come in guns blazing ready to throw hands, because that was my natural inclination. Still is sometimes, but I try to save that up for when it's like really important. I think there's a way to go in to a senator's office and drop a bomb and say all the words and get their attention, take their breath away, but do it in a way that's finessed enough that they don't realize that you've done that. And that took age with me and maturity. I'm not done maturing yet because I still have moments, but it definitely came with me being more okay with the journey I was on with my son. But also recognizing finally that, he's just an amazing kid and he matters, and I want people to know that. And I want people to see the value in his life. And the only way for me to be able to do that is to continue doing what I'm doing. And I'm ready at this point to storm our Capitol with a whole bunch of special needs adults that need services at 21 years old, and just leaving them there and let the senators and congressmen figure it out, and they can call us once they get the law changed. We'll come pick our kids up. Like, that's what I want to do, because I think there's people making decisions that have no idea what the life experience is and what the consequences of those decisions are. And so that is what I have to temper on a daily basis, sometimes an hourly basis, and sometimes minute by minute. Because I also, I have a patient load of, we've seen, 600 something families in 3 years. And so I know the direct impact that not being an advocate has on not just my kid, but hundreds of kids in my community.
Absolutely. Jennifer and Allison, did you have anything to say about it? Was fighting and collaborating and fighting collaboratively?
Well, Rene, we need to get together and talk offline, because like you, I'm still a work in progress on learning to temper that rage and finesse it so that you can still make your point heard. And again, here I go making another quote, but I think it was Theodore Roosevelt who said, speak softly and carry a big stick. And so just figuring out how to make your words be heard in the most impactful way, so that we're not actually literally physically having to beat our legislators about the head with a cane pole. But I do love Renee's idea of giving them a walk in a rare family's life for a day, because they would really quickly make moves to drive more impactful change. And I love that. And then one last thing real quickly, if I might share, for anyone who has or knows of rare disease patients in the Phoenix metropolitan area, on August 5th, Team for Travis is hosting a rare disease family. It's a community awareness and family fun night. It's at a local pool that is all abilities. It has a 0 entry into the kids pool, which then has a ramp going right into the main pool. What I'm most excited about, and I think this really ties into the last session, is we are partnering with the Goodyear Police Department to have their community services resource officers on hand and on site, and also partnering with a family trust attorney for anyone who has questions about the legalities of planning for care for your medically fragile child in the event of your demise. And she is so knowledgeable. For example, she knows how to structure a family trust or an estate plan so that your child would still receive benefits from your insurance policy, but not lose their federal Medicaid benefits or their disability benefits. So if anyone has any interest in that, again, please email me. I'm happy to send you out the invitation, and it's going to be a fun night that also provides some relief and some good resources.
That's great. Thank you. We have a lot of, in our LGS community, we have a lot of people in, it's Phoenix, you said,
It's
or
Phoenix,
is it?
yes.
Okay,
Yeah.
Phoenix, yeah. Jennifer, did you have anything to add to that?
I like to say, pace your passion. And I kind of realize like sometimes you're going to have so many feelings and emotions about what you're dealing with and going through every day and what you see. But sometimes other people are not going to see the same thing. So you have to be in a position to pace your passion. And with that collaboration, when I heard that fight and collaborate, fight is not always bad, as you just said a moment ago, Jennifer. But also when they're pacing the passion, that's where you find your collaborators. That's where you find the people that are going to walk the walk with you. There's where you're going to find the people that are going to help you know where you need to go or know where the resources are in the community. Allison just talked about something that many people may not be aware of. That's where you go and you connect and you meet people who can help you organize, help you raise your voice. Maybe someone's never had the idea that I can speak to a senator before or go to a state house or do an advocacy day. And advocacy is not just seeing people in the media or seeing people that talk to those representatives. There's a lot of planning, there's a lot of support, there's a lot of getting out the word and all of this work. So I'd like to pace my passion with that collaboration and just kind of encourage everyone to kind of pace their fight within yourself.
That's wonderful. Yeah, I just want to remind everybody who's watching, please, if you have any questions, you can put them in the Q&A. I don't see any right at the moment, so, but if some come up, this is a conversation that's open to everyone. Yeah, I think that I know my own advocacy journey started like 15 years ago. And somebody recommended that I attend or apply, I should say, for the Partners in Policymaking, which is a program through the ARC. And I'm in California, so it was through the ARC of California. And that really ignited my passion. And in fact, for me, my passion has been sort of, I love the history of the disability rights movement because I think it is so ugly and horrible, and it's a reminder that we have to know where we've been in order to move forward. Have any of you participated in trainings or something in the early days that really got you started?
Yes, for me, we were able to attend the early, and this was pre-COVID, one of the in-person Rare on the Road events hosted by the Every Life Foundation and Global Genes. And that was what really just, like you said, it's a matter of finding your people. And I knew that what I had envisioned wanting to do, this was the place I needed to be to help me get there and get the connections. And for those of you who don't know, the Every Life Foundation for Rare Diseases, they provide a tremendous amount of training and support to get you ready. They will even help set up the meetings with your members of Congress. You will probably be going into the meetings with other advocates from your local area, but it is your opportunity, and all you have to do is show up with your elevator speech and your ask, and it's a tremendous opportunity. So that's what got me involved, was that very first Rare on the Road event that one of my board members and I were able to attend in person.
That's a great plug for Every Life Foundation, because I went, no, I mean, I say that actually with sincerity. I did my very first in-person Rare Disease Week in DC this past, what was it, February, and it was overwhelming and really inspiring. So thanks for sharing that. How about Jennifer, Renee? Have you done any kind of trainings, or do you have any resources that you could maybe share with all of us?
We have something called Family Voices of Alabama, and it's a parent run and parent driven, I guess, organization. And so they had some policy training. It's been years ago, but I went to a couple of their meetings and did the policy training. And then I'm part of a couple of different nurse practitioner organizations, but was chosen a few years ago to go to DC during like National Nurses Week to basically advocate for safer nursing ratios and that kind of thing with our state legislators. And so I had some official training then. I'm not a litigious, I tend to break rules instead of follow them with my personality, and I was never involved in politics in any way, shape, or form because it frustrated me, but this has made me get more involved and more knowledgeable. Just because I didn't have a choice. And then with my program, I'm paid by the hospital, like my salary is paid, but anything I use for patients, anything I raise money for or buy for patients, and it can be something like paying for a funeral, or it can be literally equipment for home, has to be fundraised. And I am not a natural fundraiser. I hate asking for anything. I'm very independent. And through that, I've met a lot of way more powerful people than myself. And some of them are in government. And so that has also kind of given me an opportunity to finesse how I present the community needs and our state needs also in that moment. Because I never just talk about my Elijah, like obviously he's why I do what I do. But I'm in a fortunate place where I get to work with hundreds of kids that I get to advocate for and be their voice for parents who can't necessarily do that. And so that has taught me better ways. And honestly, I'm close enough to some of them that I can ask their opinions and ask their advice as to who's going to be the best person to talk to and how is the easiest way for this to happen.
That's great. I'm so glad you mentioned Family Voices, because Family Voices is a national organization and they have state chapters. And I know I've been super involved actually with the Family Voices of California in the past. And they have a health summit. And I don't know if you guys have it in your other states, but they have a health summit every year. And it's very much like a state version of Rare Disease Week, where you go and you listen to all of the different public policy issues that are pertain to children and youth with special health care needs. And they have some asks that then you schedule appointments with your state representatives, and you have and you go to the Capitol and for a Capitol Day, and you actually share your stories with your representatives. So I'm glad that you also have something like that in Alabama. Jennifer, do you have anything have you done any kind of trainings or have any resources that you wanted to share?
I want to add that I think Family Voices is a partner of Alabama Rise also. So I'm in a kind of unique position in that this is pretty much my life, pretty much every day, my work life, when it comes to the trainings, when it comes to preparing for legislative days, meeting with representatives or discussing what makes good policy, and part of my work at Arise. I also work with advocacy groups as well, sit on task force. And I also get to do the thing that not many people find as interesting as I do, the nitty-gritty policy conversations about how is this going to be paid for, or why do we need to advocate for that, or why are we asking Medicaid to handle this for someone that has a disability. So I get to kind of get into the weeds of all that, and I get to bring other people's stories with me when I do that, or support people that are there to do that as well. So I kind of seen it from both sides of getting involved in doing this with sickle cell, and then also having this position. So I'm kind of just a Jill of all trades, if you will, when it comes to this area here.
Or a Jen of all trades, right? There you
Jill of
go.
all trades. I'm gonna start
The
saying
Jen of
that.
all trades. Come on. So, okay, so we've all done our fair share of advocacy, and we all know that there are people out there who think, I can't do that. That's not me. That's, but we've also probably encountered some very people who are maybe have like, quieter personalities who you wouldn't think would want to, participate in something like this. And somewhere they found it in them to do it. So for somebody who is getting started in advocacy, who just needs to dip their toe in the water or something, what kind of advice would any of you have for those people?
I like to start with, especially when I do advocacy training with groups or facilitate, I like to start with encouraging people to kind of think about what their strengths are and how they want to use their strengths. That everyone doesn't have to know everything. So if you are a good organizer, you can find us where we need to go. If you are someone that's really good at finding locations or getting people together, advocacy is not just what we see when a law passes or we're speaking to a government or a representative. It's all those things that get us there. And it's so many of those things. It can be talking to the media. It can be showing up to support. It can also be sharing your story. Storytelling is such a huge part of letting people remember that we are more alike than we're not, that there are similar things that we care about, that sometimes we may lack understanding in some areas, but that's how we can kind of move the needle on a lot of things, that we want to tell our stories, we want to see what strengths that we have, and we want to bring those strengths forward and know that you are a part of a bigger movement that's going to have a lot more impact. And you don't have to be afraid to just be yourself, let your strengths shine, and just be supportive.
I'm going to say too
Brady.
that you need to identify exactly what it is you want to achieve with your advocacy and make sure it hasn't already happened. I have a lot of parents that spin their wheels really fast, going in one direction, and they haven't really researched what's around them already. And they do all this work only to find out that either the money they've raised can't be donated in the way they want it to be, or that there's something that already exists that's basically meeting the mission or the need that they were in the quest to fulfill.
I echo that, Renee. That's excellent advice. Do some research. Make sure, if there's something like for us, there was nothing existing that supported just isolated congenital dysplenia. So it was a no-brainer to start a foundation. But if there's a more common rare disease, see if you can come alongside and partner with their organization. And then again, do research, know your strengths. If public speaking scares the pants off of you, write letters. you know, get involved that way. And if you are, just practice what you want to say, know your ask, and get out there.
Yeah.
It gets easier with time, definitely.
I would think too, you know, like if you like sign up for register for newsletters from different organizations, because I know I get the ARC of the United States, the ARC of California, Every Life Foundation. I get all of their newsletters, and so often what I get is a call to action. And it's a very simple thing a lot of the time. It might just be put your name and your email and your zip code and email address, and then maybe they'll even give you some like they'll even write out the email for you, or you can tailor it however you want to, and then just hit send. And they make it as simple as possible. They'll just say, we need your help right now. There are a lot of Medicaid issues around the time. Just about a month ago, there is a lot of, you know, threats to Medicaid. And when we were worried about reaching the debt ceiling. So I would get all kinds of emails from the ARC, and it was just, I would just, you know, put in, I would tailor it a little, you know, I'd personalize it, but you don't have to. So, and then it goes to your representative, and then I would get an email, a follow-up email from the representative's office. So that's pretty simple for a lot of people to start doing. And I would also say that, you know, attend like a local meeting, because all advocacy does start local. You know, it's all issues are local issues in the beginning. And, you know, it could just be local for your family, and then you find other families that are experiencing the same thing. And I know when I started with the partners in policymaking, one of our pieces of homework was to just go to a school board meeting or a city council meeting or something like that, and just listen to people sharing their stories. And which brings me to perhaps I'm not sure how much time we have left, probably just a couple more minutes. So this may be the last question, but storytelling, you had mentioned that, Jennifer. And we all have a story. It's the thing we know very well, but how do we craft it to have impact? And what kind of information do you give to people when they're saying, you know what, I'm going to go and I'm just going to get up and I'm going to speak. And then 2 minutes into their very long introduction, they're told that their time is up. So how do you guide people?
So usually I ask people to think about what their story is and what they want to convey, and then look at like what your time constraints are. As Allison said, the more you talk, it's going to become much easier. I think at the beginning, sometimes with public speaking, a lot of people can be self-conscious, or you feel like you just have to get everything out, make sure they understand and know 100%. But a lot of times that's just not the case. So they're really listening to you. So whatever you're saying, your own personal story is going to be of value. And there's always ways to follow up. So remove the fear of getting everything out and being 100% right. Know exactly what you want to discuss. So what's missing? What are you advocating for? What are you asking for today? Is it awareness? Is it funding? Is it for a change in the law? What you're asking for may not, or is not going to change overnight, but again, it's going to be a key piece in getting there, whether you're raising awareness because they need to hear, or there's been enough talk about awareness. This is something tangible that we're asking you to do, to vote on, to fund, or to come out and verbally support. So stacking it up with your time as to what's important for you to get out there, what do you want to ask from them, and then following up with any other information, whether it's a question they ask, something you forgot to say, something that someone else that you work with, they wrote an opt-in about something. They have some research they've been working on that supports what that initial conversation was. So a follow-up is always that important last step that you want to take.
I love it,
Right.
Jennifer. And just follow the plan. introduce the problem, share why that problem is specifically personal to you or to your child. And then, like Jennifer said, don't be afraid to ask them to do something. Give them that specific call to action, like, we need your support in voting yes for the passage of this House bill. And if you can, leave them with a business card for if they do have follow-up questions. And you can always ask, may I leave my business card with you, or may I leave this postcard? Anything simple that they have tangible in their hands that they remember your ask.
Renee, did you have any final thoughts on that question?
Yeah, I'm a nurse practitioner. I'm not a natural born speaker. And so I kind of had to develop that. I tailor my talk to my group. And so if I'm talking to a group of doctors, I have a lot of research involved, but also I always tell the personal part of my story and how it affects me. If I'm going to talk to legislators about the need for Medicaid expansion for over the age of 21, I'm going to tell them that I'm going to lose my job. One of us is going to have to retire early. There's going to be a loss to the economy, and it's going to cost Medicaid more because my kid's going to be inpatient more because he's losing services that help keep him healthy. And so I find out a lot about the population I'm going to be addressing so that I can still talk about my kid and share my story, but then I tailor the impact and what I'm discussing based on what my goals are for that group of people. And I want to show my kid because I didn't plan ahead because I've been working my tail off, but those are my kiddos. And Elijah, this is my Elijah that just turned 18. And he's
Handsome.
why I have a career.
Well, and and that, I guess we can leave it at that. And I think that that's actually a really good thing to leave with when Allison talked about business cards. Also, sometimes, like, I always write out what I'm going to say if I can. And like if I'm testifying or something, and I always have like a picture of my handsome kid because he's a handsome kid. So and all of our kids are pretty beautiful. So thank you so much, all of you. I mean, so insightful and so many varying little gems that you have left for everyone. So thank you. And thank you, Sarita, for inviting me and I'm sure all of us. And I'll hand it back to you, I guess, to wrap things up for the day.